So if you will, at the end of the meeting, pay $10 to buy one of his books, he will stay afterwards to autograph your book so that you'll have an autographed copy. Dr. Stark was here once before and is a friend to the club. He is a retired cardiac surgeon, and we've known each other for a number of years. We worked together when I was doing stuff with the State Medical Association, when we were both, much more involved in the day-to-day operations. He's a retired cardiac surgeon and is the healthcare policy analyst for the Washington Policy Center. He's been in that role for about 4 years. And if you were paying attention to the media after the Supreme Court ruling on Obamacare, you saw him all over the media. He was on King 5 News, he was on Northwest Cable News, he was on numerous radio stations giving interviews. Very, very upfront and public on behalf of the Washington Policy Center, and a really outstanding advocate for the Policy Center. The Policy Center is very widely respected as one of the premier think tanks in the U.S. Dr. Stark has written multiple studies, including the impact of federal health care reform on Washington State, and the book that he brought, The Patient-Centered Solution. He has spoken on these topics around the state and around the country. He served on the governing board of Overlake Hospital in Bellevue, is past chairman of Overlake's Foundation Board, a member of many professional organizations, and an active member of the Woodinville Rotary. I'm a Rotarian too, so I want to get that plug in as well. And we have Ward Lee here today, by the way, who's the assistant district governor for Rotary. So there's some thanks. Anyway, without further ado, an excellent program. Big round of applause for Dr. Stark.
Well, thanks very much, Gary, and thanks to the Northwest Club here for inviting me to speak this afternoon. It was the comedian Will Rogers who said, I don't make political jokes. I just watch the government and report the facts. And that's essentially what we do at the Washington Policy Center. We watch the government, we report the facts on policies that they make. As Gary said, the Washington Policy Center is one of the larger state-based think tanks. We actually have 6 different divisions. Healthcare is simply one of those divisions. We also have education, the environment. I believe Todd Meyer actually spoke to this group a few months ago. Transportation, we have a guy in Olympia who does nothing but the budget. And so we deal with all different types of policy areas. Now, we are a 501c3. We are based on free market principles, essentially. We receive no taxpayer money, and I know some of you are already members of the Washington Policy Center. If you would like a free trial, 6-month trial, kick the tires, see if you want to become part of our organization, I brought some cards with me, and they're on the table. Fill one of these out, give them to me, or put a stamp on it, mail it in, and we'll get you on our mailings, on all our updates, all our publications and so forth for 6 months. At the end of that, if you like what you see, you like what we're doing, great. We'll send you an envelope. You can give us a contribution, or we can part company if you don't think that's exactly what you want to do. Also, as Gary said, a year and a half ago, we looked very closely at the Affordable Care Act and what the impact was going to be on the state of Washington. And we compiled that into a policy brief, and I brought a number of those copies. They're on the table outside the door. Please feel free to take these, take as many as you'd like, actually, pass them out to your friends, neighbors, and so forth. We'd kind of like to get that message out, and I have more copies if we run out. Now, I personally don't like political jokes either, just like Will Rogers, simply because it seems too often they get elected. So, what we're going to do today is try and eliminate the politics. And what I'm going to try and do here is just give you the facts. We're going to talk about the Affordable Care Act, the new federal health care legislation. And I want to cover 3 things. First of all, I want to give you some background on the legislation. Just a little bit of background. Second thing I want to do is explain to you what is in the legislation. And then the third thing I want to do is tell you where we stand today. The legislation, as you know, passed almost 2.5 years ago. So we've had 2.5 years of experience with the legislation. Where exactly does it stand today? So the first thing, as far as background, the Affordable Care Act is the most unique piece of legislation ever passed in this country, especially when you consider social pieces of legislation. And what I mean by that is our healthcare system accounts for about 1/6 of our economy, or our gross domestic product, about 17% of our economy. This legislation controls or influences or has some impact on 17% of our economy. And the thing that makes this unique is the fact that it passed along strict party lines. There were no Republicans that voted for the ultimate bill that President Obama signed. And that, folks, in the history of this country has never, ever been done. When Medicare and Medicaid passed in 1965, it passed with support of both D's and R's, and it passed with support of the majority of the country, the majority of the citizens of this country. Now, you can say what you want about where Medicaid and Medicare have gone over the last 40 years, but when it passed with the support of the entire country. And it was 137 pages long, that entire bill. The Affordable Care Act, strict party lines, 2,700 pages. So you can see right off the bat that this is a different animal. This is totally unique in the history of the country. Now, let's go back in our time capsule, our time machine, to the end of 2008 and the beginning of 2009. Many of us have scars, financial scars from that period. Some of us still have open wounds from that period. And the American public was polled at the beginning of 2009. They said, what are the things that are most of concern to you and your family? And no surprise, well over 80% of the American public said the thing that we're worried about, the economy and jobs. 10% of the American public said the number one thing I'm worried about is health care. And what did Congress and the President do for 12 months, the entire year of 2009? They debated health care. And we wound up with the Affordable Care Act being signed into law in March of 2010. Now, the cost of the Affordable Care Act. As many of you are aware, there's an organization, allegedly a bipartisan organization in Washington, D.C. It's called the Congressional Budget Office. And what the CBO does is they look at any proposed piece of legislation and they say, what is this going to cost the country for the first 10 years? That's all they're charging, is looking at the first 10 years. And so they came up with a number of $940 billion. That was the cost of the Affordable Care Act over the first 10 years. And they estimated that the Affordable Care Act would reduce our debt by about $100 billion over that 10-year period of time. And that's what our elected officials voted on, those numbers. The problem is, or the issue is, that the Affordable Care Act has 10 years of taxation to pay for 6 years of benefits. Now let me say that again. We're going to be taxed for 10 years, but the benefits don't kick in until 2014. Now, many of us in the policy world were very concerned. Okay, that's the first 10 years, but what happens the second 10 years where we have 10 years of taxation, but we have a full 10 years of benefits to pay for? And estimates at that time, when it was signed into law, were upwards of $2.5 to $3 trillion for that second 10-year period of time. That is a bit of background. We can go into the details about legislatively how this was passed. It's kind of an interesting story, but I won't belabor that issue. But I wanted to give you folks that sort of background as far as the legislation and how it came about. So the second thing we wanted to discuss then was what is actually in the legislation. And believe me, if we discussed every detail in the legislation, we would be here until Halloween or Christmas or maybe even Easter. I mean, it's 2,700 pages. But the fundamentals are very, very easy to understand. First of all, the individual mandate. This is the foundation of the Affordable Care Act. What the individual mandate says is every adult, 18 or over, must have health insurance or pay a fine or pay a penalty. Now that has never ever been done in the history of this country, where the federal government said, as part of your citizenship, you must purchase a private product. You must own a certain private product. That has never been done. Now you might be sitting out there saying, well, yeah, Stark, but wait a minute. I drive a car and I got to have, the government says I got to have automobile insurance. Well, that's true, but that's a state law. It's for liability only, and you have a choice as to whether you want to drive an automobile or not. The individual mandate in the Affordable Care Act does not give you a choice. It says you have to do this. Now, some of my really conservative friends, they say, well, wait, if we had a conservative legislator, a Congress, and a conservative president, we could mandate individual handguns. Everybody would be forced to carry a handgun. Now, that's crazy. And you stand up in front of people who are of a liberal persuasion, and they will laugh and they'll say that's ridiculous. But the fundamental is the same, folks. This has never been done. Now, the Supreme Court, this went all the way to the Supreme Court, as you know, and it was a very, very interesting decision. I stood up in front of groups and I said, the Supreme Court's going to vote 5-4 and they're going to find this unconstitutional based on the Commerce Clause or based on the Necessary and Proper Clause of the Constitution. That's the only way that the Supreme Court can vote. What the Supreme Court did, specifically Chief Justice Roberts, what they did was they didn't even consider whether it was part of the Commerce Clause or part of the Necessary and Proper Clause. They said there is a possibility and potentially a probability that the fine or the penalty for not having health insurance, that individual mandate, there's a chance that that penalty is actually a tax. And certainly Congress, constitutionally, has the ability to tax American citizens. So consequently, theoretically, if this is a tax, then this is constitutional. The individual mandate is constitutional. And so that's how Roberts and the 4 liberal justices got around the decision. And so they found the individual mandate was constitutional. So we're stuck with it. It is the law of the land. For an individual, the cost, that penalty, that tax, is $700 a year or 2.5% of your gross income, whichever is more. So that gives you an idea what the tax is. Individual mandate. That's the foundation of the Affordable Care Act. The second bit of foundation is the employer mandate. And what that says is, if you are an employer and you have 50 or more employees, then you must buy health benefits for your employees or pay a fine or a penalty or what's now called a tax. Okay, fair enough. I mean, most employers, although that number, that percent is decreasing, but most employers today provide health care benefits. But what is the tax? What is the penalty? Well, in their infinite wisdom, Congress put 2 levels of taxation. If you are an employer and you do not provide health care benefits for your employees, you will pay a $2,000 per employee tax per year. If you do provide health care benefits, but an employee or more, 1 or more employees opt out, then you will pay a fine or a tax of $3,000 per year per employee that opts out of your health benefit plan. Okay? So either $2,000 or $3,000. So if you talk to Regents or Premera here in the state of Washington and you say, what is the average cost for an employer of an employee health benefit plan last year? The number is about $8,000 to $12,000 per employee. So I got to tell you folks, you don't have to be a math major to figure out that $2,000 or $3,000 is a lot less than $8,000 to $12,000. And what we're going to see, intended or unintended consequence, we are going to see more and more employers dropping employee health benefits. As a matter of fact, a few months ago, actually early in the spring, one of the large research polling companies in the country, it's called the McKinsey Company, they surveyed thousands of employers, and the numbers are startling. They found that 30% of small employers were planning to drop employee health benefits, and 50% of small employers were considering dropping health benefits. And the really scary thing is 10% of large employers were planning to drop benefits, and up to 30% of large employers were planning to drop benefits or considering dropping benefits. So you can see, again, intended or unintended consequence. So we've got the individual mandate, the employer mandate, and the third thing you need to be aware of is what I like to call insurance mandates. And there are some folks who believe the entire Affordable Care Act is nothing but insurance reform. And you can potentially make a case for that, but there are two insurance mandates that you really need to be aware of and understand. Again, the foundation of the Affordable Care Act. The first is called community rating. And what community rating means is everyone goes into the same risk pool, no matter of age or no matter of how ill you are. So what that means is if you're young and healthy, you will pay more for premiums than you would in a free market. If you're older and sicker, you will pay less for premiums than you would in a free market. Now, that is community rating. The second insurance mandate that you need to understand is called guaranteed issue, or pre-existing condition. You've probably heard about this one. What this means is, regardless of how ill you are, how sick you are, how traumatized you are, a private insurance company must sell you insurance. Now the corollary to that is with homeowners insurance. What it means is if your house is burning, State Farm must sell you homeowners insurance, even when your house is burning down. That's guaranteed issue, folks, very simply. The problem with community rating and guaranteed issue, and believe me, there are millions of people in this country who think those are great things. The problem with them is insurance companies cannot mitigate their risk. They do not know how to plan an insurance premium if community rating and guaranteed issue are forced upon them. So what the insurance companies said during the debate in 2009, they said, okay, if you're going to make especially guaranteed issue part of the Affordable Care Act, then we need everybody in the risk pool. And that goes back to the individual mandate. So you can see how this thing comes sort of full circle. Those are the foundations. And again, we could spend months talking about what's in the Affordable Care Act, but those are really the things you need to understand as far as mandates. Okay, so the CBO said it's going to cost $940 billion. Where does that money go? Well, after you take out 4 or 5% for administrative overhead costs, paying for the 160 new agencies, commissions, administrative bodies, and all that stuff, the overhead, the money is equally split between two areas. One is an expansion of Medicaid, and the second is going to state taxpayer subsidies in the state insurance exchanges. And it's about equal. It's about $450 billion into each of those. Okay, so let's take them individually, just real briefly. First of all, an expansion of Medicaid. What is Medicaid? Well, just to kind of give you the background here, Medicaid passed in 1965. It was a safety net for kids of poor families. It was an entitlement. The budget for Medicaid when it passed was about $500 million per year. The first year we spent about $1 billion on Medicaid, and by 1970, 5 years later, the country was spending $5 billion for Medicaid. Now Medicaid, when it passed, was supposed to be 50% funded by states, 50% funded by the federal government. And that's about how it comes down. The state of Washington, we pay about 57%. The feds pay about 57%, and the state pays about 43%. That's the existing Medicaid. 1975, about 10% of the American public was in Medicaid. Last year, about 20% of the American public was in Medicaid. Medicaid costs last year were about $450 billion, and that number is anticipated to double by 2019, to double in the existing Medicaid program. The problem with Medicaid is poor reimbursement for the providers. Physicians, doctors, nurses, nursing homes, hospitals are reimbursed about 40 to 50% of what private insurance pays. And the consequence there, unfortunately, is our Medicaid patients are finding a very hard time today accessing health care. Yes, they have insurance, they have health insurance, that it's very difficult for them to find a primary care or private doctor who will see a Medicaid patient. The doctors cannot pay their overhead, they can't keep their doors open with what Medicaid reimburses. And what the Affordable Care Act does is it adds 16 to 23 million more individuals into an already bankrupt Medicaid program. It adds any adult over the age of 18, their insurance, if they make less than 133% of the federal poverty level, their insurance will be Medicaid. So that's where half the money goes, into an already bankrupt program. The second half of the money, again, about $400 to $450 billion, goes into federal subsidies for people to purchase health insurance in the state health insurance exchange. Okay, what's a state health insurance exchange? It's like, it'll function like a clearinghouse or like an insurance broker, if you will. It's federally mandated now that each state set up this exchange, such that people and small employers can access health insurance through these exchanges. Now, the federal government and state government works together to decide what benefits go into the insurance plan sold in the exchanges, and they decide to a certain extent pricing for those plans. So who qualifies for these billions of dollars in subsidies? Well, anyone making less than 400% of the federal poverty level qualifies for a subsidy. And so you say, okay, Stark, what's 400% of the federal poverty level? Last year, folks, it was $89,000 for a family of four, which means this is going to cut not only through the poor socioeconomic group in this country, this will cut right up to the middle to upper middle class in the United States of America. So what we're seeing is at least 30 million more people will, in one form or another, be obligated to the federal government to receive their health care benefits and their health insurance. So that's where the money goes. Okay, so where does the money come from? This is also very easy to understand. There are two places where the money comes from. The first is about a $500 billion cut to Medicare. Okay, now most of you are probably aware what Medicare is. It, along with Medicaid, passed in 1965. It is the insurance for seniors in this country. If you're 65 and over, your insurance is Medicare. Medicare passed in 1965. By 1990, 25 years later, it was 7 times over budget. The unfunded liability for Medicare, if the Affordable Care Act is not repealed, the unfunded liability is about $40 trillion. If the Affordable Care Act is repealed, the unfunded liability will be about $89 trillion. Medicare absolutely, positively needs to be reformed. But it needs to be reformed in an intelligent fashion with a scalpel, and not in the fashion that the Affordable Care Act puts on us with a chainsaw. This is going to cut, like I say, about $500 billion right out of Medicare. It's going to affect Medicare Part C, Medicare Advantage. Probably will eliminate that. There is an independent payment advisory board that's being set up now of 15 bureaucratic, unelected officials to decide what is most effective from a healthcare standpoint as far as treatment, prevention, diagnosis, and so forth for our Medicare patients. Believe me, folks, the other line item there is going to be cost. What is the cost going to be? How are we going to eliminate $500 billion? So that is where half the money, this $500 billion cut to Medicare, that's where half the money is going to come from. The other half of the money is going to come from the largest tax increase in the history of this country outside of war. Everyone who accesses health care will be taxed. It's not just the rich. Insurance premiums will be taxed. Insurance companies will be taxed. Medical device manufacturers, drug manufacturers. Again, anyone who uses health care, those taxes will be passed on to them, and they will wind up paying it. Also, there is a tax on the rich. If you make more than $200,000 a year, or if you're a couple and you make more than $250,000 a year, you will pay almost a 1% increase in payroll tax, and here's a brand new one, a 3.8% tax on unearned income. So what is unearned income? Well, it's tax on dividends, capital gains, rental property, and in certain cases, the sale of homes. And so all of a sudden, Medicare is separated from payroll. Remember, Social Security is a payroll tax. Medicare used to be a payroll tax. With the Affordable Care Act, it separates that. And from a policy standpoint, that opens a huge door as far as unearned income paying for entitlements in this country, specifically Medicare. So that's kind of the background, the basics on the Affordable Care Act. Now, the last thing we want to talk about is where we stand today. And you probably heard that the American Medical Association came out, they supported the Affordable Care Act, the AMA supported that. Subsequently, many physician groups have been polled, and as Gary said, I'm a retired surgeon. The surgical groups, they essentially wanted to wash their hands of the entire Affordable Care Act, except for the plastic surgeons who wanted to put a new face on it. And then the dermatologists, they didn't want Congress to do anything rash to begin with. And the psychiatrists, they thought the whole thing was madness. And then finally, the obstetricians, the baby doctors, they thought when Congress was actually debating this, they were simply laboring under some misconceptions. So that's the take on it. So the last thing I'm going to talk, where do we stand today? Well, we've had 2.5 years. So remember, there were 5 things that we were promised during the debate. It was going to bend the cost curve of healthcare down. It's going to provide universal coverage. If you liked your insurance, you're going to be able to keep it. It's going to eliminate waste, fraud, and abuse, and we were going to get better quality medicine in this country. Okay, cost. Well, the CBO has looked at this number again, that's $940 billion. The new number as of 2-3 months ago is $1.76 trillion. The CBO says that's what it's going to cost now. And oh, by the way, it is still going to reduce our debt by $100 billion over the next 10 years. But also baked into these numbers is, instead of that $500 billion cut to Medicare, the new cut to Medicare is $700 billion. And that balance is going to be made up in increased taxes. The chief medical actuary in Washington, D.C. is a guy named Richard Foster. And he has looked at this. And remember, last year we spent 17% on health care in this country, 17% of our economy. He predicts with the Affordable Care Act by the year 2020, we will be spending 21% of our economy on health care. So in no way will this bend the cost curve down. If you like your insurance, you will be able to keep it. Nope, the new number out, research is showing now that at least 14 million people will lose their employer-sponsored health benefits. And folks, I believe that's just the tip of the iceberg. If Medicare Advantage, Medicare Part C really does go away, that's 7.5 million of our seniors who are going to lose their insurance, and they're going to be put back into Medicare Part A and Part B. So in no way, if you like your insurance, you'll be able to keep it. Universal coverage. When this debate began in 2009, there were 50 million people without health insurance for one reason or another. At least 20 million will still be without health insurance, even with the Affordable Care Act. So in no way will this provide universal health insurance coverage. Will improve or will eliminate waste, fraud, and abuse. There is absolutely nothing in the Affordable Care Act that will do that. And even liberals can agree with fiscal conservatives that in the Medicaid and Medicare program, at least 15%, if not up to 25 or 30% of the costs in those programs is because of waste, fraud, and abuse. And so that's got to be factored in and baked in as well. And then lastly, will the Affordable Care Act improve quality of our health care? Well, we believe that if our Medicaid patients and Medicare patients have a more difficult time accessing health care, seeing a doctor, getting into a hospital, that in no way will that improve the quality of health care in the United States. So it wasn't that we were lied to, it's just that we've had 2.5 years of experience now to see where this is going, and the direction is not a direction that will favor the patient, their family, and so forth moving forward. I want to thank you very much. I think we have time for questions, and we can open it up.
Remember, just a couple of rules about questions. Members get to ask questions before guests, and if you'd stand up and give your name and ask your question. Go ahead, Bill.
Hi, Bill Geyer. Thank you for coming today. Americans love freedom. They have a history of rebelling against overreach of government. And the most obvious one, of course, prohibition. We can see that, of course, in the draft in Vietnam. Has anyone made an estimate as to how many individuals it would take to simply not participate in the act that would then collapse the system?
No, that's a fair question. The answer is I don't know, but we may find out. We may find out simply because states like Texas, like Florida, Idaho to a certain extent, they are dragging their feet as far as participating in the Affordable Care Act. I was on a conference panel with Governor Scott from Florida, and he is bending over backwards to not put anything in place down there in Florida. And so we may find out the answer to that come November. We'll see. Yeah, it's a good question. Yes.
Mark Nelson. I have a friend in Indiana who's a school teacher for 20 years in Indiana school district near Notre Dame. And he stated last night that his health insurance premiums in the school district were going up from approximately $160 a month for he and his 2 children and his wife to approximately $1,000 a month, and the $3,000 deductible going from a 90-10 plan to an 80-20 plan and 60-40 out of network. Is this an indication of insurance companies in certain states imposing the ACA, the Affordable Care Act, on the districts now beforehand, unlike Scott in Florida? I think they're helping us enormously if they impose this on the public servants.
Yeah, you're absolutely right. I mean, that's what we're seeing. We've seen premiums go up. Last year, on average, they went up about 10 to 11% in the state of Washington. And insurance companies are anticipating 2014 when these benefits kick in. Remember that community rating and guaranteed issue, and they are trying to figure out how
before the election. What a terrible thing.
Yeah, they're simply trying to figure this out, and even Foster, the actuary from Washington, D.C., he anticipates that we're going to see increases every year, even with the Affordable Care Act in place. And just as a corollary to that, I think ultimately what we will see is we will see our private insurance industry go the way of public utilities. And I think that's what's going to happen. They are not going to be able to keep their doors open selling private insurance products. Benefits are going to be dictated by the government. Their pricing ultimately will be dictated by the government. And I don't think they're going to be able to survive as private industry. Yes.
Anton Caruso, isn't it great being a retired doctor? Will illegal aliens be covered under this plan?
Will illegal aliens be covered under this plan? There is language in the bill that says absolutely, positively, no. Now, there's a way around it. There is at least $60 billion in the plan that goes to community clinics and community health organizations. And if you look at where most illegal aliens in this country access health care, it's through these community clinics. And so they're ramping up. And again, if you talk to liberals, they're very pleased because it does include undocumented immigrants, as they call it. Now, let me be very clear about this, though. We have an immigration problem in this country, and we have a health care policy problem in this country. And they're sort of overlapping, but they're really separate. We've got to figure these out individually. It's a good question, but I think we need to figure them out separately. Yes.
I'm Bill Schoonover, Oak Harbor. So I am over 75. I have cancer. And when this comes into effect, everything else, and if I need medical treatment, it will go before this board or whatever, and they will say, that's too expensive, take a pill. Is that what they're saying?
The short answer is yes. Yeah. And believe me, folks, we can go around the world. We can look at other healthcare systems. One of my partners was Canadian. Excellent surgeon. He practiced in Canada for 4 or 5 years. Trained up there, practiced up there. but got fed up with the system and came down and joined me in Bellevue. And this was back in the early 90s. And he had been with me about 2 or 3 months, and finally he came to me and said, Roger, he said, how do you decide who to operate on over the age of 70? I said, what do you mean? He had excellent surgical judgment. I said, what do you mean? And he said, well, we never saw people in their 70s for bypass or heart surgery in Canada. They actually never got to the subspecialist. And so one way or another, these countries ration care, and that's what we're being set up for here with the Independent Payment Advisory Board.
Oh, sorry, Lisa Sherry. When Chief Justice Roberts called it a tax, the mystery to me is he basically rewrote the entire act. And so I'm asking myself, Congress did not vote on it the way it now was passed. How can this now become the law of the land and one of the most fundamental changes that this country will ever have undergone?
Yeah, that's the $64 bazillion question. What you need to understand is the Supreme Court, they held 4 hearings basically over 3 days. And the first thing they did on Monday of that 3-day, Monday, Tuesday, Wednesday deal is they heard arguments about whether this was a tax or not. And even Justice Ginsburg said, well, in no way is this a tax. And so we thought, okay, well, that'll be a non-argument then when they get to the individual mandate. And yet that's what Roberts pinned it on. And so there are all kinds of things. I'm not a constitutional lawyer, but another thing is a tax bill has to originate in the House of Representatives. Well, what they passed was essentially the Senate bill and the House approved it. We can go into that if you want the details. But the bill that President Obama signed did not originate in the House of Representatives. So right there, it seems to me it should be a constitutional bill. Anyway. Yes, sir.
Ray Darrow, from your point of view, why would a young person want to go through all the years of college and residency and so on to become a doctor in this new environment?
Yeah, that's a really good question. And I've got to tell you that medical school enrollment applications, they're staying pretty steady. But the last poll I saw, and I don't remember, it was hundreds, if not thousands, of physicians. Over 90% said they would not recommend medicine for their children or for kids of their friends. And so this may be a hope on my part. I think what we're going to see is we're going to see a new generation going into medical school, going into nursing school. They're going to have different expectations. And by that, I mean they're not going to be entrepreneurs, they're not going to be in private practice for themselves, they're going to be employed by hospitals and universities, things like that. They're going to be shift workers, 8 to 5, 5 to 1, and so forth. And I think that's what we're going to see.
Sorry, the majority of the docs.
Yeah, Gary says it's the majority of docs in Bellingham, and it's becoming the majority down in King County as well. Yeah, and that's a national trend. Yeah. Yes, ma'am.
Ms. Halterman, in October, my husband and I's HSA plan goes up 5%. My son, who has the same exact plan, is 26, his goes up 30%. So it is happening. Is there any possibility that the HSAs will survive this?
The answer is probably not, and it's not that the HSAs are going to go away. It's that the high deductible plan that accompanies the HSA is going to go away. Just as kind of background, HSA stands for Health Savings Accounts. And from our standpoint, we think high deductible insurance plans, major medical plans to cover major kinds of problems, just like house and home, and then having a health savings account where you can save for the day-to-day kinds of stuff in a tax-free environment, we believe that's a terrific tool and a terrific alternative. And the problem is the high deductible plan will not meet the benefit specifications of the government, and so they are going to go away, making health savings accounts a thing of the past as well. That's our concern.
I wanted to find out if a person doesn't have health insurance and he gets fined, and he still doesn't buy health insurance, will the fine be double or more?
No. As the law is written now, the answer is no. And, we talked about the employer making that financial decision. Well, if you're a young, healthy 30-year-old, $700 a year is probably going to be much less than you'll pay for an insurance premium. So I think what we're going to see is a lot of individuals, especially in that 18 to 34-year-old range, the young and the healthy, the invincible, we're going to see them paying the tax, the fine, and just opting out of health insurance. I mean, if they get ill, if they break their leg or something, they can always sign up. I mean, that's not a big deal, and then get covered. What we anticipate is that tax is going to go up. Maybe not on the individual side, but on the employer side. And that $2,000 to $3,000 will get closer to that $8,000 to $12,000 over time. I don't know that, but that's kind of what we're anticipating.
You mentioned that the Medical Association was in favor of it. The reason that they voted in favor of it at the time was that they were exempted from a scheduled reduction in the fee schedule. And since then, there have been a number of special interest groups that have negotiated delays or not being taxed. You said that the first 4 years, and we're now in year 3, I guess, of that, we're supposed to be building up a large amount of money. Yet we've been exempting the groups that are supposed to be paying for it. How is that going? And do you see, as each new tax steps in, special interest groups have gotten themselves exempted from those taxes?
Yeah, that's the whole point here, folks. Is the state government's broke, as Jason can tell you, and the federal government is broke. And yet, what they have done when the Affordable Care Act passed, there should have been a 21% reduction in what physicians made. As of next year, I think it goes up to 33 or 35% reduction in reimbursement for doctors. That has not taken place. That probably will not take place. So remember we talked about the financing for the Affordable Care Act. Half of the financing comes from these provider reimbursements that are not taking place. So what's that going to do to the federal debt? I mean, it's going to run it up farther and farther and farther. You're absolutely right. Yes, sir.
Wayne Farber. I have a Medicare Advantage plan. I've had it for about 3 years. Fabulous. And I understand from reading the bill, which I've read 2 or 3 times, that they're probably going to go by the wayside, as you said. And at that point, I'll be looking for a Medicare supplement plan. How are they going to be affected by the ACA?
The Medicare supplement?
Supplement plans.
Yeah, I'm really not sure. But your alternative will be hospitalization through Medicare A, provider reimbursement through Medicare B, and it'll be the standard thing. And you make a good point. You've been really happy with it for 3 years. And if you look at Medicare patient satisfaction, one of the highest satisfaction groups is people who have Medicare C, Medicare Advantage. They love it. They think it's great. And yet that's the part of Medicare that's probably going to go away for sure.
Yeah, Greg Brown. Yes. My question is, when we change the government in November, will we really be able to turn this around?
Yeah.
And how long will it take us to turn it around?
Again, that's like the $64 bazillion question. All we can go by, I think, is what the candidates are saying. If we take them at their word, yeah, it's going to be repealed. And parenthetically, this November is probably the most important election, at least in my history, and probably most people in this room. So, the direction of the country is going to be decided here. And I think it potentially could be another 2010. I think that the federal government would potentially have a mandate if the numbers come out pretty strong. And yeah, and like I said before, there are states that are dragging their feet. They haven't done a thing. And I will tell you, in the state of Washington, we already have our insurance exchange in place. Medicaid expansion is being looked at very seriously and probably will occur. And so in the state of Washington, we're a little hard pressed. But other places in the country, I think it's going to make a big difference. Yes, sir.
I want to understand how you're going to be taxed if the insurance covers you permit, place a permit, I'm not saying your current insurance level is worth like 15 or 20,000 a year, looking at premiums. Is that going to be counted with your taxable income and increased by that amount?
No, I mean, you're going to have to put on your tax form what insurance plan you have and what the specific benefits are in that plan. You as an individual or you as an employer, if you're filing that, and then those costs are borne by the individual or by the employer. Yes.
Robert Affolter. In Washington State, we've got two different sets of legislation under the Insurance Commissioner. One's a Direct Care Act and one's a Discount Care Act. Do you know how those two acts will be impacted by this?
I don't. I'm sorry.
I'm going to use the mic because I set it up. Randy, no more. I trust Mitt Romney about this much more than I trust Barack Obama. And he said the other day, Mitt, that he would like to keep the portion of the Affordable Care Act that allows children to stay on their parents' policy till age 26 and pre-existing conditions. And those two things alone will have a tremendous financial impact on the insurance industry. And he has promised to repeal the Affordable Care Act, and I sort of believe him, but those two elements could be the hook to bring back portions of it until they have it just the way they want it anyway. Do you see it that way?
Yeah, unfortunately I do. The first half of your comment, though, I'm not too worried about. We hear a lot about this, what the benefits of the Affordable Care Act that have already occurred. And one of them is kids up to age 26 can be on their parents' plan. Well, okay, but that's kind of a non-starter. I mean, kids up to age 26, yeah, there's some isolated cases. We see them on the front page of the Seattle Times and so forth, how they're being helped by this. The vast majority of those individuals, they're young and healthy, and being on their parents' plan, that's not a big deal. The guaranteed issue is, and that is a colossally huge issue. And again, if you're an insurance, a health insurance company CEO, I would be very concerned about that.
Well, I'm a senior citizen, and when I was 65, my corporation, Seattle First, forced me to go on Medicare, and I didn't want to. I said, I'm already on a group health insurance. Why don't you just keep me there and raise the price if that's the way it's going to be, if I'm going to be more expensive? And then they said, no, they don't do that. Well, I said, then what will you do if I just refuse to join Medicare? And he said, we will drop you. So doesn't that mean that business itself is partly responsible for some of this, because they force people who can take care of their own health care on a group plan being retired, force them to go on Medicare, and so the insurance companies stuck the citizens, well, the government, with our medical care. So I can see some problems in that too. It's business that's partly to blame.
Yeah, you've touched on a bunch of issues. I mean, first of all, coming out of the blocks, unless you're continued grandfathered on your employer insurance plan when you reach the age 65, your only option is Medicare in this country. And I mean, say what you want about Medicare, folks, but it's nationalized, it's socialized medicine. We've got 45 years of experience with this program now, and we know that it's bankrupting the country. So the other just little aside on Medicare is, if you did drop out of Medicare, say, okay, I don't want anything, I'm not on my employer's plan, but I'm going to opt out of Medicare and pay out of pocket, you would lose your Social Security benefits. They're tied together, and that's a very little known fact in this country. They tie them together.
Plus the doctor could go to jail if he takes your payment.
Correct. Go to jail or not get Medicare reimbursement for 2 years. Yeah. Yes, sir.
Don Hansey,
recently, you had mentioned earlier in your talk about there's some talk about sales tax on selling of your house in some cases. Well, it's my understanding we just recently sold our larger house to downsize and move to a smaller place due to age and different things. And I had understood that if we did that after January 1, 2012, there would be a 3% gross sales tax on the gross sale. Would you explain how that's going to work?
Well, first of all, I'm not a real estate guy, so I don't know all the ins and outs of real estate. But the way that the Affordable Care Act is set up, first of all, this is a tax on unearned income. Anything, like we talked about, dividends, capital gains, rental property, and so forth. Second thing is you need to be in the what is considered the rich category. In other words, your income needs to be at the $200,000 a year level, or for a couple, $250,000 a year level. Now, the way that it would work on the sale of a home for that 3.8% tax to kick in is you get about a $500,000 deduction on the sale of your first house. If there are gains on your house from when you bought it to when you sell it, and you go over that $500,000 limit, then potentially, and you're in that rich category, remember, potentially you'll be subject to the 3.8% tax on whatever that capital gains, if you will, on your house sale. Now, most people will not be in one or more of those categories, but it can potentially occur.
If the gain is large enough, it can push you up into that.
Yes, that's exactly right. Yeah, if the gain is large enough, you could go up into that category. The other thing you need to understand, we didn't discuss this. This is a little subtlety here. That 400% of federal poverty level tied to the subsidies in the state insurance exchange, that is adjusted based on cost of living and inflation year by year by year. So in other words, it was $89,000 for a family of 4 last year. You'll be eligible for subsidies in the year 2016 if you make $96,000 a year. So you can see how that's going to go up. The rich, on the other hand, that $200,000 a year income, that is not tied to inflation or the cost of living, which means as the country gets more prosperous, as inflation grows, more and more people are going to get caught up in that rich category. And it's going to function like the alternative minimum tax does now. And it started out with just a handful of people, and now it's hundreds of thousands of people. That's the same thing that's going to happen with the Affordable Care Act.
When you were talking, the gentleman was talking about benefits. They are getting ready to tax your benefits that you pay your employees. So if you pay for medical contributions as an employer, that share that you pay that doesn't even come out of the employee's paycheck, not their share, the employer, they are looking at taxing all employer benefits. So that is coming down.
Yeah, I mean, potentially it can. Yes.
Paul Sandler, a retired military on around TRICARE for life. Are you familiar with what's going to happen? Does that just disappear or what?
No, that's a good question. And TRICARE, like you say, is part of the military health insurance plan. It's administered and it's run through the Medicare program. And I speak for a lot of individuals. I mean, we believe TRICARE ought to stay in place. There is some speculation that TRICARE will get caught up in this whole thing, and we will see cuts to TRICARE just like we see cuts to Medicare and so forth. So that's being worked out, but it's a concern that we have. Other questions? Great.
One more question. Tea Party hobbit, racist, Jewish fellow. What is the exact mechanism to repeal Obamacare? As I understand it, we're going to national Congress who have Romney and Ryan saying they're going to repeal it. Maybe I'm wrong in that supposition.
Well, again, I'm not a constitutional lawyer. I don't exactly know what would be required. I think it's a law on the books. I think if you got a majority vote of Congress, you could repeal it, and it's signed by the president. I think the whole thing can be repealed. Having said that, remember, there are certain states, like Washington, for example, that already has a state health insurance exchange in place. In statute here, that was a big part of what our legislature did in 2012 down in Olympia. Will that go away too? I don't know. Will the expansion of Medicaid in the state of Washington go away? I'm not confident that it will. Thanks very much, folks. You've been a great audience.
Stark's books are available for $10, and he'll stay after to sign them. I look forward to seeing everyone next month at our candidate and initiative forum. Be involved in the campaigns, people. There's never been a more important time. And thank you for coming. We are adjourned.